Our in-house therapy program is extremely important to us because it allows us to have much more control over the way that we deliver care to our patients.
What happens a lot of times with companies that have contract therapy is that the therapy department their contract. They come in, they do their work, and they leave.
The staff are ours, they're full-time employees. When we need a therapist, we know that it's going to be the same therapist every single day.
That way we can follow through with everything we're doing day to day. It makes the patient feel better. We get to know them on a more personal level.
And it has been proven to show quicker results, and so patients are able to go home faster.
Another benefit of having in-house therapy is that there is great continuity between nursing and rehab.
It allows both sides, therapy and nursing, to come together and work holistically with the patient, all aspects of their care. Not just therapy, not just nursing, but together to get them home sooner.
Because rehab department is there all the time and they're part of the big picture team, there's better communication between nursing and therapy.
Our therapy staff is able to interact much more fluidly with our nursing staff to create a smooth continuum of care.
You're part of not only the therapy staff, but you're part of the nursing staff, you're part of the social services. You take part in everything that has to do with your patient's care.
If there's a changing condition with a patient, the nurses have a better chance of communicating that to therapy, and the therapist can modify their treatment to the needs of the patient and vice versa. If the therapist notice something during their treatments that they think that the doctor needs to know or the nurses need to know, they can go and communicate that back to the nursing team and they can take care of the patient even more so.
Because the staff are ours, we don't have to answer to or make requests from an outside organization. We have control.
And they really can do anything outside of the box to do what is needed for the patient's recovery and rehabilitation.
We can do rehab using a Wii video game system. We can do outside therapy using a putting green with a golf course. We have tracks set up outside of our buildings with uneven surfaces so that we can get the best care possible and the best results out of our patients.
We get to know them on a more personal level. We can joke with them, make them feel a little more at home when they're away from their own environment.
They're our staff, so we know that they're going to be with that same patient every single day, and they can make a much more strong connection with their patients because they know that they're here with us for the long term and they're not going to be going to another facility the next day or the next week. We're committed to them, they're committed to us, and in turn they're also committed to our patients.
That's what I think a lot of our patients like, is the fact that we get to know them personally and try to keep it family-oriented.
One of the great things about being an in-house therapy group is that we're accountable for what we're doing and we have ownership of what we're doing. They allow us the freedom to be successful.
I think it's pretty rewarding when they finally get to go home and they stop by the gym and they're giving us all hugs and saying they're going to miss us and they're going to come back and visit. And we've actually had a lot of patients come back, walking back in and just visiting, bringing us lunch. It's kind of nice.